Okay, I will now demonstrate a range of motions assessment for hip abduction. Is that okay with you?
Yes.
Okay, so this assessment will be checking how far your hip can move. It lets us know your flexibility and if your movements are normal. So lie on your back and relax. And this is the goniometer. The axis of it will go to the ipsilateral ASIS at bony landmark right here. And the moving arm will be on the anterior midline of the femur. And the stationary arm will go to the contralateral ASIS right there. So when you abduct your hip, you'll be moving your leg outwards. I'll demonstrate the motion to you. So you want to abduct, move it outwards as far as you can. Okay. Now you will now go ahead and do it slowly. Abduct. Okay. And then back. And now relax. Was there any pain in the process?
No.
Okay. So now you would take note. The goniometer has a range of 41 degrees. So the patient abducted their hip 41 degrees. Okay. I'll now demonstrate the range of motion for ankle dorsiflexion. So what this test is I'm checking how far your ankle can move. This will help let me see if your flexibility and movement of your ankle are normal. So you want to be lying on your back and relaxed. The axis is the distal part of the lateral malleolus. So that would be over here. And the stationary arm will be the lateral midline of the fibula, which is right here. And the moving arm will be the lateral midline of the fifth metatarsal. So this one right here. So the patient will flex their, dorsiflex their ankles. So I will now demonstrate the movement. It's like this. And you want to go as far as you can. Okay. And now the patient will do it herself. Okay. So the patient did 18 degrees of dorsiflexion. I'll now write that down, 18 degrees. She did 18 degrees dorsiflexion over ankle. Okay. I will now demonstrate a range of motion assessment for the knee extension. Is that okay?
Yeah.
So I will now be checking how far your knee can extend. Basically, it will let me see your flexibility and movements are normal. So you want the patient to be lying down and relaxed. The axis will be on the lateral epicondyle of the femur, so right here. And the moving arm will be on the lateral midline of the fibula that's going towards the lateral malleolus. And the stationary arm will be going towards the lateral, going towards the greater trochanter from the lateral femur midline. So what the motion is, I will now demonstrate to the patient. So you want to extend your knee like that. Okay, so now the patient will do it herself, slowly. Okay, now relax. So the degrees of her knee extension was 4 degrees. Now I will write that down. Patient had 4 degrees of knee extension. Okay. Okay, I will now demonstrate a manual muscle test for the hip abduction, targeting the muscles gluteus medius and minimus. Is that okay with you?
Yes.
So this test will measure the strength of your hip muscles, and let me grade you on the scale of 1 to 5 to see how to measure the strength of the muscles in your hips. Okay, so the patient will be lying side lying, and the lowermost leg is in a flexed position for stability, and the uppermost leg is straight. So I will now demonstrate to you the range of motion that you'll be doing. So you would move your leg and abduct your hip like this, moving your leg up, and I will be applying resistance. Okay, so my right hand will be at the hip for stability, and now you can lift your leg up, and don't let me push down. Okay, now you can relax, because she was able to go through her full range of motion against my resistance. I would give this MMT grade of 5. I will now demonstrate manual muscle test for the knee extension, targeting the quadriceps muscles. So this test will measure the strength of your knee muscles. Is it okay if we do the MMT test?
Yes.
Okay, so the patient will be short sitting to the side of the bed, and we will have a towel underneath the her thigh to help for support and comfort. And I will now demonstrate the motion that the patient will be doing. So your leg will be an extension, so you will be extending your knee, and then I will be applying resistance, and you do not don't let me bend your knee, and don't let me be able to push it down, okay? And now we will do that now. Now hold it and don't let me push down. Okay, gonna relax now. Is there any pain?
No.
Okay, so because the patient was able to withstand my maximal resistance, I will give this MMT grade of 5. I'll now demonstrate the manual muscle test for ankle dorsiflexion, and I will be targeting the muscles, the tibialis anterior. So this test will measure the strength of your ankle muscles and see how well you can dorsiflex. So the patient will be lying supine, and you would want them to bring their foot upwards and towards their body. And then I will be offering resistance, and you want to bring your foot in and don't let me pull it down. Is that okay with you?
Yeah.
Okay. So you can now bring your foot up and in and hold it. Don't let me pull down. Okay. You can relax now. Was there any pain during that?
No.
Okay. So because the patient was able to withstand my maximal resistance and I could not bring her foot or pull it down, I will give this MMT grade of 5.